people have two approaches. They can either be reactive or they can be proactive. When people are reactive, they wait till they have a problem and then they try to find a solution. But obviously, the much better situation is to be proactive, where if you have a problem, a health issue, you go see Dr. Ann, and you say, "Hey, I have this health problem. What can you do to help me?" And Dr. Ann's an amazing practitioner. She has so many different skills. She has many ways to help heal you, and now she has all these advantages of regenerative medicine that Illuminar has helped Dr. Ann develop. So we have some amazing ways to heal and help people, and you don't have to wait till problems arise. But if you do have a problem, we're here for you as well. Change to the next slide. I'll get back off that one. Sorry, I'm having a fun technical difficulty for a moment.
Dr. Ambrozic, it sounds like your computer has the cursor outside of that.
Oh, is that what that is?
Yeah.
Okay. I'm trying to, there's a pop-up that came up and I'm trying to get rid of it, just saying that the meeting's being recorded now. I can't get rid of the pop-up and it won't let me change slides. Let's see.
Maybe just
something traumatic. You're always telling me.
And how does pain affect your life? So pain can affect you from a lifestyle standpoint. If you can't get out and do the things you like to do, if you like to walk, golf, any type of activity outside of work, work itself, it's important. If you're not able to work because you're in pain, that can affect your income, affect your whole life. And then obviously relationships as well. If you're in pain all the time, you're never happy. And so that can affect how you are around other people, how you take care of yourself, others as well. Now, one of the mainstay of regenerative medicine is the use of what's called structural tissue allografts or allografts. And what allografts are is basically putting perinatal tissues inside of a vial and then using those to inject and help people. And so I've introduced Dr. Ann to the structural tissue allografts that we use. And these tissues are amazing. They help heal everything that you can possibly think of. What happens to us when we're born, we have billions and billions of what we call stem cells, and stem cells are just part of what the body uses to heal. They're like coaches on a football team or a team, where they kind of coordinate how the healing process happens in the body. And they use substances called exosomes and many others to help the body heal itself. Excuse me. And with this diagram, you can see excuse me. A little tickle in my throat here.
You can see that we're born with what, 10,000?
Yes, we actually have, we're actually born with millions of actually billions of stem cells. And unfortunately, by the time we're already teenagers, 15 years old or older, we've lost 90% of that healing power. And every year we get older, we lose more and more. So as you can tell, when we're in our 30s, 40s, 50s or older, we really don't have much gas left in the tank. And that's normal. That's part of aging for us. And so that just explains why as we get older, we start hurting more. We have arthritis, we have other chronic medical conditions that come up and make us feel ill. And so what we use exclusively is tissue that comes from the umbilical cord. Now, years ago, we used to take tissue from our fat or from our bone marrow, and we would re-inject it into ourselves, and that would help maybe about half the time. And the problem with that is that these tissues, as we get older, we have fewer healing powers, fewer stem cells, as we saw on that other slide. And then we also are unable to heal ourselves properly. So taking stem cells or tissue from our own body is not an ideal source, but the umbilical cord, as it turns out, is an amazing source of tissue and an amazing source of healing. And that's what actually helps heal a mom or baby if there's any type of injury during pregnancy. And as we mentioned, allografts are just the tissue that we take from the umbilical cord, put in a vial. Now, we're very blessed. This is one of my really good friends, Dr. Neil Riordan. He and I have done work together for years. We've published medical research together. And 20 years ago, he's published over 100 different articles on stem cells. He has a couple books that he's published and healing. And he's who I work very closely with. He's helping me directly with our project in the Middle East. We'll be working directly with him in his labs for that. But he's a mentor and a really close friend of mine, good friend of mine. And so with these tissues that we can get from the umbilical cord, what can we heal? Well, any type of orthopedic condition you can think of. So if you have arthritis or bad knees, if you have shoulder issues, back issues, neck issues, you name it, anything from head to toe, these tissues are able to heal. They help osteoarthritis. So every one of us has arthritis as we get older. And unfortunately, there's varying severity in arthritis in different parts of the body, but these treatments can help that. What's amazing is they've actually been shown to help all kinds of other conditions, neurologic autoimmune conditions like neuropathy, bulging herniated disc, radiculopathy, even hair loss, alopecia, and in men, erectile dysfunction. So that's what's great about this field, regenerative medicine, is there's very little to no side effects. I've been a doctor for 20 years and I've never seen anything more powerful and yet is more safe than these treatments. There's no drugs needed. There's no rehab. There's no need for surgery typically after someone's had these treatments. Excuse me. This is a gentleman that we treated at Illuminar, and he's was in his 50s. He's not a professional athlete. Shouldn't say professional athlete there, but he had terrible injury to his knees, had bad arthritis, and he saw 4 or 5 physicians, and they all told him that he needed a knee replacement. He didn't want to have that done, and so he came and got an X-ray done, which showed me that was his X-ray on the right. And I'm sorry, on your left when you look at the diagram, and then the one on the right is 1 year later, the same knee, and that just shows the power of these treatments. And back pain is a very common problem. I had a ruptured disc myself about 5 years ago, and I was told I needed emergency surgery, and I said, no, I don't, thank you. I had one of my colleagues inject me with one of our allograft treatments, and within a month I was feeling perfectly fine. I haven't had any pain since. So these treatments are incredible. So if you know anybody with back or neck pain, work amazingly well for arthritis, discs, any kind of issues in the back or neck. The last thing you want to do is end up having a spine surgery or back surgery, that's for sure. But unfortunately, many people have those done every day in our country.
Ambrozic, somebody's asking about PRP, the protein-rich plasma procedure, versus what you're talking about now. And would you care to address that?
Yeah, those are totally different things. So PRP is basically taking your own body's blood, putting it in a device called a centrifuge, spinning it down, and then taking the plasma portion of that blood and re-injecting it. And there is some growth factors. There are some things that can help the body in that plasma, but it's kind of just a band-aid compared to the treatments. The allograft treatments or exosome treatments that we do are so much more powerful, so much more effective. It's an adjunct. It's something that can help you, but it's not going to prevent you from needing surgery or things like that. It can give you some pain relief and temporarily, but it's not a cure.
Thank you.
Yeah, no problem at all. Now this keynote, this was a video that's supposed to be playing, but I don't know. For Hannah, if you have those videos I sent you, we could play those later I'll just keep going on the presentation here.
Okay.
Um, and then other treatments that Dr. Ann has available to her and to you all. Peptides are amazing. They're branches of amino acids that can help the body heal and perform like a hormone without the side effects of hormones. And this is one of my favorite ones, BPC 157, which is a healing peptide that can help you everything from stomach issues to arthritis, pain, other things as well. Up down here in Palm Beach, and at some point, Dr. Ann will have a hyperbaric chamber, and those are pretty amazing that help heal with the use of oxygen. Pulse wave, that's another device or treatment that Dr. Ann will have eventually. She does have ozone therapy, which is incredible. Ozone is 3 molecules of oxygen when they're put together, and they can heal they help with pain relief, they help with tissue oxygenation, inflammation, all these types of things. So they're a great adjunct or treatment that Dr. Ann may use along with the allografts to help her patients up in Boston. Red light therapy is excellent. We have one of these chambers here, and IV therapy, Dr. Ann has that available now, where she can treat patients with vitamin deficiencies or just needing rehydration. NAD is a specific peptide that we can use through an IV drip as well. And Dr. Ann is an expert on nutrition and fasting and dieting. She can talk about all that with you. I'm very blessed throughout my career, the last several years, I've dealt with a lot of real fun clients and celebrities like the Gronkowski family, who are quite famous up there in Boston. Tyrese Gibson, he's a famous singer, actor. Ryan Klesko, he's a former Major League Baseball player for many teams, and here are a few other people as well. But
I have those videos teed up. I have the one of Gronkowski.
okay, great. So maybe what we can do, I think that's pretty well the rest of this presentation. This is talking about how, if you're looking for these types of treatments, Luminar and Dr. and myself, we're probably the best source because we've had so much experience between myself, Dr. Riordan, Dr. Bafidis, our whole group of colleagues and people that we work with. We bring that experience with Dr. Ann to her patients. So if you want to go to where some people have had experience, know what they're doing, that's definitely our practices.
Dr.
But,
Burke, it looks like we have some questions. Myra,
Sure.
do you have a question? You just wait, you're on mute, so I just asked you to unmute. So just unmute your phone.
Yes, I do. And it's so funny that I would get this email this evening because I was talking to a friend of mine who's getting ready to have knee surgery. I said, do you really want to do that? I said, you should try to find alternative, ways in dealing with that, because I said, I don't think you really should do it. But that's one thing. But I'm having surgery on Tuesday, next Tuesday, for my heart.
Oh, wow.
I'm having an ablation done. But after that, I know that I have some problems with my lower back, the bulging part and the hip. So I'm wondering, the treatment for that would be what? And is it at whole body and Braintree? I can get it done. And is the price, can you give me a price, what it's going to cost? Because I really want to try to get started on that immediately. And how many treatments would I have to have?
Those are all great questions. So first off, good luck with your ablation on next week. I know you'll do very well. That's a really safe procedure, although everybody gets concerned when they have to do with the heart. But Dr. Ann and Courtney, they're more than able to do any treatments that we talk about today and in the future. So having your back or your neck treated or your hip treated, those are all things that they can do, and them talk to you about pricing.
So I guess the first step would be looking at x-rays or MRIs, things like that.
Courtney would do a consult we can set up a time for her to get on the phone where, or in the office, whichever you prefer, where we really get an idea of what's happening with the spine. Is there a disc protrusion and how big and at what spot? And then we can determine if we think you would respond to 1 versus 2 injections. Sometimes people will start with 1 injection, and many times the spine, I don't know, Dr. Ambrozic, what you see with this, but we've done a number of spinal injections. We've had post-surgery, we've had disc herniations, we've had disc herniation post-surgery. And those treatments can be felt in 2 weeks or a month, or and then we'll use little ozone, which we include in our pricing the first month after injection and then the month following. Single stem cell injections are $7,000 typically. We're offering our clients in these early stages of release, and for those who are coming into our informationals, the $5,000 fee. We have set up so that you can charge these on our Shopify and pay for them monthly or however you choose to, in case the resources aren't there to pay in full. So there's options for people that way.
Yeah,
Okay.
we set up
Yeah.
Klarna and Afterpay for financing. And then I'll send everyone an email after this for you guys to be able to book a private informational session, either Zoom like this with our nurse Courtney, or you can come into the office, and she has some spots available for Friday.
Okay.
Did we answer your
And I,
question?
being a
Yeah.
patient along with the doctor, I can't stress enough how important these treatments are. And if you're having these pain issues, there's no need to wait. I waited too long in the past for knees that were killing me, and I got treated, and then now my knees feel like they're 20 again. I can't stress enough how amazing these therapies are. And you're under amazing care with Dr. Ann and Courtney, so they'll take great care of you. Sure you get
No,
better.
that's fine. But what I need to know is, well, I'm asking, is this an ongoing?
It's
Or
typically
is it-
one injection. I think there's a rare
Really?
where typically 1 injection. And I think
Uh-huh.
there's an occasional case that might need a second injection. And that's
Okay.
that's rare, but just to know that could be a possibility.
Yeah,
Okay.
everyone
All right.
heals differently. And like in my case, when my back had ruptured my disc, I
Mhm.
got 1 injection 1 time. And it's been good for it's 5 years now. Over 5 years, I've had that treatment. So
Really?
not everybody's the same. I wish I could say everyone is going to be
Yeah.
exactly the same.
Yeah.
And no
We had a
doctor
client-
will
We had a
predict-
client in Monday to get his second knee injected because he felt so terrific with the first one, which he was one of
Yeah.
our clients through the end of October. So I think he felt better within the first 2 weeks.
Now, can I ask you one more question, and then I'll let somebody else go? Okay. Now, hospitals do injections too, correct? Or is this different from
This is
your
this is
injections?
100%
Because
different.
they do them too.
Yeah.
But
Yeah, what they
Hospitals
do-
are usually using cortisone, a steroid, which can actually cause harm to the tissue and destroy the tissue.
that's
over
right.
time. Where
Yeah,
these
yeah.
are allograft healing compounds, so there's no danger in damage. It's
All
very,
right.
very different process.
Okay.
Thank
All
you,
right.
Myra. Our next person with their hand up is Shifra.
Shifra.
Hi.
Right.
Yeah, I had a couple of questions. Thank you for this. Actually, it's a few. Like, I still don't understand exactly what this is that you're injecting. Is there any danger from the injection? How effective does it tend to be? Like, what percentage of people respond to it? And I was thinking of myself, I have neck pain with, I think some of it is from Lyme, but I also have a friend who is just in pain, like all over her body. She has fibromyalgia, and she fell, and she had COVID. And so she's just in excruciating pain, like all the time. And she's, considering options that I find very frightening. Yeah, I just wonder like what percentage of people are helped? Does it hurt when you put it in? Is there any risk factor? And what exactly, I don't quite understand what it is that you would be, that you're injecting.
Okay, I'd be happy to answer this one. Um,
Sure.
so yeah,
I'm
so
just running.
what we're actually injecting is tissue from the umbilical cord called Wharton's jelly. And inside there, there's billions of everything the body uses to heal. So there's exosomes, there's growth factors, cytokines, numerous substances that cause the body to heal. And
Okay.
these treatments are very, very effective. 80 to 90% or more people respond with one treatment. And they can be used to help all kinds of conditions. So I've treated many people with fibromyalgia. I've treated many people with autoimmune diseases as well. And then obviously any kind of orthopedic problem like back problems, neck problems, knee problems, all the things we were talking about. So the treatments are unbelievably effective. They work really well. The only thing is there's no doctor in the world that has a crystal ball that can tell you you're going to get better in 2 weeks, you're going to get better in 2 months, you're going to get better in 30 days. We just don't know that, but we do everything in our power to help people get well as soon as possible. And when you use the knowledge that Dr. Ann and Courtney have, they're able to get you well very quickly, as they've been talking about. And they're seeing amazing results with their patients.
Yeah. Yep.
Dr. Ambrozic, there's another question. How does these procedures impact bone healing? I.e., at the age of 61, my hip fractured. The X-ray did not pick it up, but the MRI did. And in lieu of surgery, the bone has started to heal after 2 months of crutch therapy, so to speak.
Yeah, so these therapies actually can accelerate healing. I just saw a lady today that flew in from Atlanta to see me, an older patient of mine, and she had a fracture in her toe. So we treat fractures all the time. We help people. When you give the body healing substance that it needs, it actually can heal everything from osteoporosis, osteopenia, fractures, you name it.
And then another question is, where are the umbilical cords coming from?
Great question. So these are donated cords. The moms and babies have cesarean sections, so they're monitored all through their pregnancy. And after the mom has a baby, this cord is given to the labs that we work with, and they take the tissue from the cord and they basically put it in a vial and freeze it for us, and then ship it to us when it's needed. So that's the very simplistic way to describe how we get them. But it's a very complex procedure that the FDA and all the labs are very monitored very closely about. And the moms and the babies are followed all through the pregnancy. They make sure they don't have any health issues, any diseases, anything like that. And so it's a wonderful process, and they're actually donated cords that the labs that we use.
Does anybody?
Hi.
Yeah. You have a question?
Well, I'm so sorry. I ran to try to plug my phone in because it was running out of juice, and it shut down about 3 minutes ago, and I had to reconnect. So embarrassingly, I couldn't hear like the last couple of minutes of what you said.
Oh, no problem. So what were your questions again?
So I'm so sorry. My questions were, is there any risk factor? You told me what the percentage, like something like 80 to 90% of people respond. Is there any risk factor from the injection itself? What exactly is in it? Stuff you get from an umbilical cord, is that what you're saying?
Yes. So we work with an amazing lab that works directly with the government, the FDA, and they actually have a special registration with the FDA. So they've studied that for literally thousands of people. They work directly with Louisiana State University as well, and they've done research showing that well over 5,000-6,000 treatments were done, and not a single person had a negative outcome, which is fantastic. And people say, how is that possible? Because when you take even a Tylenol or an aspirin, you can have side effects. But the reason for that is that this is healing tissue. These are things that the body uses to heal itself. So it's not,
Okay.
the body doesn't feel like it's a foreign substance. And
Yeah.
when you put it in your body just embraces it. And kind of like I tell people, it's like these old cartoons you used to see with Popeye the Sailor Man, where he'd eat a can of spinach and he become the superhuman. Well, that's kind of
Right.
what our bodies feel when we put these treatments in them. The body embraces it and it just starts going to work. It starts healing. It starts helping.
Yeah.
And the results are just incredible. So,
Mhm.
so not only is it the most powerful treatment I've ever seen as a doctor, but it's the safest at the same time. So,
Okay.
but really, there's no risk to the patient other than, unfortunately, there's some cost associated with it. But Dr. Ann's putting on an amazing special for everybody tonight who's listening in. So I highly recommend you take advantage of it, because these treatments are in big demand and the prices, I'm sure, will go up after the new year. So
I believe it.
We have some more questions. Can this affect the healing of skin and scar tissue reduction as well?
absolutely, it can help any tissue in the body. So your skin can improve, your
I can speak to
um,
that. So I had a thyroid scar. Do you remember doing the sub?
Wait, let me just put this so people can see you better.
Now, this was cool. So when we did one of our trainings, I've been having shoulder trouble, lifting and pulling patients for adjustments and all, and playing tennis. And the shoulder was quite painful and quite restricted. And so I went to have an injection in my own shoulder, but at the same time, I had thyroid surgery. And I had a really, not a bad scar, but a little scar across where the thyroid surgery took place. I don't see anything there now.
Yeah, it's
So it's
completely gone.
completely gone. And I wasn't even trying to treat that. I think we were looking to, just enhance the muscle area and tendency for migraines and things like that. And I had old thyroid surgery, so I wanted to do as best I could to help that the other side of the thyroid repair. So we did an injection in the front of the neck, and lo and behold, I don't have a scar. So that's cool.
I have a thyroid condition too.
Yeah. Tell us more about the scars, Dr. Ambrozic, what you've seen.
Everything you just described, Dan. So there's actually tissues, like in the past, we've actually done research with Dr. Riordan on a tissue called a patch. So someone would have surgery and we'd put this actual regenerescent tissue inside of them after their surgery, and it would help them heal and recover. So the scarring would be minimal, all this type of thing. But we've taken that one step further nowadays, and Dr. Ann is a testament to that. We can directly inject in scar tissue, and that will help that heal. And then getting an injection can also help your whole body, your whole skin. So it's pretty amazing.
We have another question. For someone with issues in multiple parts of the body, for example, one hip, wrist, does the treatment require separate injections into each problematic site? And for something like fibromyalgia, where would the injection occur in the body?
Great question. So usually multiple sites need multiple injections. So if you have two bad knees, you'll need one injection to each knee. Now, for someone with fibromyalgia that has pain throughout the whole body, we have protocols where we can do treatments that'll help heal the whole body. And Dr. Ann can talk specifically to that person, those people with those conditions, and give you a special price, because you'll need more treatment to get well. But we have ways to heal people now to help the whole body. So she'll be able to work out a very special price for that for you all.
Can I have an appointment for Friday?
Yes. Let me get back, since you guys are here right now. Let me just find out what times we have available. I'll run and I'll come right back.
Okay. All right. Thank you.
These have all been great questions. Thank you, everybody, for your great questions.
Yeah, this has been very informative. And it's
I-
funny because I've been thinking about all of this, because I said that once I have the ablation, I wanted to work on my hip and my lower back. And then I was going to see if I could work on my thyroid. I haven't had the surgery for the thyroid. I wouldn't let them operate, but I've had a thyroid condition since 2005, where I take one pill, 5 milligram every day, methimazole. And so, that was one of the questions when they started talking about my heart, because they think it was affecting my, my heart, my thyroid. but that's not what happened. I stopped taking the pill, but I want to, since she mentioned thyroid, I got kind of happy because now I can target that as well.
Yes, absolutely.
Could I
So I'm
ask one
excited.
more? Oh, I'm sorry. I mean, to interrupt.
No, go on.
So,
Well, now it sounds great. I hope it's very helpful to you. I bet it will be.
Mhm,
Um,
I think so.
I had a question. Is it painful when it's injected?
Not at all. Dr. Ann can tell you
Mm.
she's had I've had, none of my injections have been painful. They're very, really last just a few seconds and they're
So
not very deep.
Courtney's our nurse practitioner. She'll do the actual injection and patients will say, are you done? That's it. So 9 times out of 10, we're just seeing, it's very, very fast. She's really skilled and I'm usually in the room and you don't even know it happened.
Mm.
another
So
one.
do you have a, I'm sorry, I'm sorry.
Okay, so let me just
I'm
give you
sorry.
the, so on Friday, we have 9
Mhm.
to 3. The last appointment will be 2:30. So 9 to 2:30 appointments available. You can either come in office or you can do a Zoom with Courtney, and she can answer all your questions and get you set up with an appointment. So if you guys wanted to put in the chat which time you'd like, I have all of your emails, I believe, if you RSVP'd to this event. So you can just tell me and I'll send you confirmation emails on with the Zoom link or, the office information for you to come in. So you can do that. And then we have, Shifra, do you have one more question? Because I have another question.
Yeah, I was just actually for this friend of mine, if for the if it's pretty much throughout the person's whole body, approximately how much would that cost?
Again, probably Dr. Ann would have to look at the
Okay.
records and
Yes.
severity. Because again,
Mhm.
it's people that have a more severe condition are going to need more therapy than someone who doesn't.
Yeah.
Okay,
After reviewing her records and kind of seeing what all she's had done and therapies, she'll be able to come up with the
Okay.
amount of therapy that person will need. So, yeah,
Okay.
so I'll let you two sort that out,
Okay.
but
Thank
the
you.
great news is there's hope. Fibromyalgia has usually been a death sentence for people in the
I
past.
know.
There's no therapy at all, good luck, here's some any depression pills for you to take. These therapies can actually really, really help with fibromyalgia. I've helped so many people with that and autoimmune conditions as well. So this is great hope for her.
And like how much pain reduction do people tend to have?
I've had people go completely in remission where they didn't have any fibromyalgia at all.
Wow.
Yeah.
Wow, okay.
And
Is
also,
that typical or?
It can be, yeah. It's in my experience, it has been with these therapies, yes. We can
Okay.
really help people
Thank you.
tremendously where they haven't had help before.
and,
Wow, thank
Yeah.
you.
and since you guys all have people, I mean, we all have people in our lives that have chronic pain and we definitely want to help them. So if you guys do have people, we are offering a $500 referral fee for anybody in your life that you're like, okay, they need this. I need them to be healthy and happy and not have this pain anymore. And so we want to heal as many people as possible. So we're offering that to all of our patients so that we can, help more people. So a couple more questions are, what is the shelf life of these procedures? How long are they effective until another procedure needs to be done?
Great. Well, unfortunately, and the fortunate part of this is usually we don't know. They can last for 5, 10 years, even longer. So I had my back injected 5 years ago. It's still doing great. I may need another injection in a couple of years. I just don't know. If you take good care of your body and you listen to all the great things Dr. Ann has to say at Whole Body and her staff, that you may not need another injection for many years. But if you have a condition that's pretty severe to begin with, maybe you'll need another injection in a few years or sooner. It's just, it's really a case by case situation, but in general, people do very well for many years.
And then another question is, does this help with rheumatoid arthritis?
Yes, absolutely. Yeah, rheumatoid is considered an autoimmune condition. And so I've treated many people with rheumatoid arthritis. And again, we've been able to put many of those people into remission where they're not on any medications and they're not having any pain anymore. So It's a wonderful therapy for that.
Somebody asked me earlier today about the peptide injections. They're injected once a day, 5 days a week for how long?
It really depends on the peptide and what you're trying to achieve. For BPC 157, which is the healing peptide, typically people stay on that for 3 to 6 months or more. Other peptides can be in the similar type of time frame. Could be just for 3 months, could be for 6 months, could be longer, depending on what the condition and the problem is.
Thank you.
Myra, what time did you want your appointment?
It has to be after 12. I work in Braintree. I'm
Okay.
Braintree. You hear me? I work in Braintree. I work in Needham. And anytime after,
Do you want to come into the office? Or
like
do you-
around 1. Yeah, I'll come to the office.
Okay,
Yeah,
I'll put you in.
I know
for
where the
1.
office is. Pardon me?
1 o'clock, Myra.
Okay, 1 o'clock is fine. Yeah, because I used to come here on a regular to see Nancy.
Excellent.
So I've been there.
Nice.
I'm Captain James
Lisa, did you
Teeter.
want an appointment scheduled?
TV.com and click on quizzes. And guess who said it?
Mhm.
Picard.
Does anybody have any more questions?
I don't like constipation.
No, I'm good. I can't wait to see, to get started.
So we're in the office. We'll be here for another 10 minutes or so. If you have a question and you want to give a shout to the office, that's great. Thank you, everyone, for
Thank you. Thank you so much.
Yeah, spread the good
Thanks for your
word.
time tonight.
Yeah, we're really excited to be growing and spreading this word.
Oh, wait, we have a couple more.
Thank you.
questions. For something like spine or hip injection, are you injecting into the spine or the joint? And is that fluoroscopy guided, or how is the exact location ensured? For a hip issue, is traction used?
Typically, we use ultrasound instead of fluoroscopy. Ultrasound's a much safer modality, and there's no radiation involved with it. And it's actually very effective at treating hips and the spine and other joints as well. And Courtney's very able to use the ultrasound machine, so no worries there.
And then another question is, what is the trade-offs between cortisone shots, various tablet vitamin options?
Well, cortisone's that's a group of medications called steroids, and unfortunately, steroids have a lot of bad, terrible side effects. And I really haven't prescribed steroids for years because they cause a lot of they help with inflammation in the short term, but they actually cause a lot of terrible side effects. They weaken tissue. They can cause osteoporosis, osteopenia, thinning of the bones. They can cause suppression of the adrenal glands. They can cause hypertension. They can cause diabetes even. I've seen people get a cortisone injection and next day or two develop diabetes for the first time. So there's all kinds of horrible side effects from steroids, and unfortunately they're overused, in my opinion, in our healthcare system. But over time, as more of our treatments become mainstream, we'll see less and less use of the steroids and a lot more use of these amazing regenerative medicine treatments.
And I think there was also a question about supplements involved there. So we're multifaceted, and there are lifestyle factors that are going to affect your outcome and your need for continued care. So when we recommend a supplement program, say one of my common arthritis support products is called Boswellia Complex, and it has celery seed in it, which helps the pH of the joint. It has some boswellic acids, which help inflammation, ginger, anti-inflammatory, and then turmeric, which is reparative and antioxidant. So will you still need those? What I'm seeing so far in the office of the people that have had injections, if the inflammation in the body comes down, both through treatment and lifestyle, your need for supplementation decreases. I feel, and my experience is this time, is that most people do need to supplement some degree. Maybe you'll need fewer products, and the more active you are on the lifestyle changes, especially as they relate to inflammation, then the fewer products you're going to need.
Absolutely.
Another question, how do these procedures react with the muscles versus bone in terms of reaction? Muscle atrophy is my concern.
Yeah, they can definitely help with muscle atrophy. They can help with strengthening muscle. I treat a lot of professional athletes, and Rob Gronkowski is one, a famous one up in the Northeast area where you guys are. And he came to see me. He had a terrible quad injury in his muscle, and he had inflammation. He had terrible pain, and he got some of our therapies, and within a few weeks and months, he was back to normal. So we can definitely help with muscle atrophy. We can help with muscular injury, and help people recover from those as well.
Let's watch Rob. I think this will be
Yeah.
fun. I love this video.
Tampa Bay Buccaneers tight end.
Former
Going into
Patriots.
my 11th season in the NFL. I've had about 9 to 10 surgeries throughout my whole NFL football career, and then on top of the 9 to 10 surgeries, I've also had plenty of injuries that just didn't require surgery. That have been just nagging me throughout the last couple of years. My body wasn't feeling that great. Just the functioning of my mind and body just weren't really that together. So I just felt like it was the best thing to do was stop playing the game of football due to how physical the game of football is, how much contact there is in the game of football. And while I was retired, I met Dr. Rick, and Dr. Rick performs many procedures, not surgery procedures like treating you with stem cells. And stem cells are tremendous for the body. They have helped me heal tremendously. All the injuries I've had, all the scar tissue that has been built up throughout my whole body, all the surgeries that I endured. And that's why I stopped playing the game of football, to find alternative ways to heal my body. And stem cells have helped me just to another level. Dr. Rick has helped me to another level. Definitely getting other treatments as well. Getting the stem cells in my body while getting massages, body work done to my body to help the stem cells just do what they do, just helps out tremendously, with how I feel. The stem cells just don't work right on the spot. They work over time. They work over days. They work over weeks. They work over months. Stem cells just literally speed up the process, help you recover that much faster from a workout too. They're just tremendous. I love them. Dr. Rick has helped me out just so much, and he's the man. He's the man with the master plan. But there was one area in particular when I really needed it when I retired was my quad. I took a big shot in the championship game my final year before I retired. And my quad was really, really swollen, beat up, full of scar tissue. And he helped replenish that quad. We took some stem cells and shot them into my quad, and definitely helped me out because everything was healed on my body, including my quad, to help me make a comeback to
And we
the
also
NFL.
have this
After working
machine
out
here.
super hard, just going to get some treatment from Dr. Rick just helps speed up that recovery process just so much to where I'm just ready to go again the next day. And that's what it's all about. Training is very crucial, but recovery is just as crucial as training. After my first stem cells injections into my body, I felt like approximately about a week to 2 weeks is when it really started kicking in. And then from there on, it just kept getting better and better and better. Today, I got some NAD through an IV. I got the whole vitamin bag through an IV, just so I can replenish my whole body with vitamins, and on top of it, hydrate my whole entire body at the same time. And now I'm just taking care of my body even more, getting the stem cells that I need right now in the off season. So then when the season comes around, when I get hit and stuff, it's just like a walk in the park. I would tell other athletes that are suffering from pain, that are suffering from other injuries, is to start focusing on your body, is to start focusing on your self-care, is to start focusing on what you got to do to recover. And if you're not really, into stem cells, into IV treatments, you should definitely take a look into it. It definitely heals. It's super good for your body, super good for your cells. It's super good for your cell tissue. Just overall, it's a game changer over time. And just start really focusing on how to truly take care of your body if you want to last a while and you want to stay out in the field. During the season, I played all 20 games. It was the first time in like 10 years since I played
Yeah, we all know
the
that.
entire season. Oh, that was just an incredible incredible accomplishment for myself right there. Everything that I did to help my body come back, to help my body recover. So I was ready to go again and play my first years in the NFL in my 30s and play at a high level and play every single game. And I never
Dr.
done that
Rick,
before.
we wish that
since,
he met you
my
when he was on the
2011
Patriots, so he
season.
could have
So
played every game.
that was just spectacular itself, too. And it was just an amazing feeling and just an amazing accomplishment to just go out, go back and win another Super Bowl.
Well, we're happy that he won that Super Bowl with our boy Brady, but it would have been nicer, like, Patriots days. Here's another one. Should I play this one or this one?
The last one.
This one?
No, one before.
This one.
I love this video. Our office staff watched it when Dr. Rick was here training us, and this really got everybody excited to help our patients.
So welcome back. Tell me about your how you felt before you came to see us.
Well, before I came to see you, I was walking on a stick and a walker. I couldn't bend down. I was having a lot of difficulty moving, and I was getting worse and worse. And I refused to have back surgery because everybody I talked to was not happy with the results.
Yeah.
So this was a great shot. We had experimented around talking to a lot of other people, and your program sounded the best.
Wonderful.
So that's,
So tell me what you weren't able to do a few months ago that you can do now.
I couldn't bend down. I couldn't walk fast. I had to hold on every time I get up and down. I had to use, when I go out, I'd have to walk with a cane. I couldn't turn fast. I was just having great many issues with movement. I was in constant pain.
And when did you start noticing a big change?
Well, after about 3 months, I started to notice that the numbness from my hips down seemed to be moving down. And now it's just down to my toes.
Okay, great.
And I got feeling in those. It's not normal, but it's a whole lot better.
Yeah, yeah. And you had your back pain. What was it before and what's it now? Like it was like a
Well,
9 or
back,
10 before.
yeah, it was a 10 before, and now I'm down between a 0 and a 1.
Wow, fantastic. And so what kind of things can you do now you weren't able to do before?
I can do everything now that I used to do 20 years ago. There's nothing I can't do that I haven't found anything I can't do. Well,
Playing sports?
I walk, I do exercise. Used to ride a bike. We haven't repaired our bikes, but there's nothing I feel I can't do. I'm thinking about trying to go bowling again
Oh, wow.
and
Fantastic.
see how that does.
Yeah, yeah.
But I feel like I'm up to it now.
Fantastic.
I feel like up to everything, I'll be 76 shortly, and I feel like I'm 50.
That's awesome. That's awesome.
No problems there.
Mr. Rick, can you show me how well you could move before your treatment? What kind of limitations you had?
I could bend down this far. I could turn like this. And when I'd walk, I'd have to walk
You had a cane to walk.
with a cane or a walker. It was very difficult getting in and out of a car. It was just becoming a real issue for me
This was a whole year you've been with this.
for a whole year, and it was just getting worse and worse.
Wow. So show us how you can move now. Can you bend down now?
All right, now I can get down.
When he did that, I
Wipe
was
the
like,
floor.
wow.
I can jump up and down,
Wow.
turn.
That's amazing.
I
No
can
cane.
sit down and jump up, getting in and out of the
You don't
car.
need a cane anymore.
No more cane.
No, that's
Oh,
amazing.
So I'm doing great.
That's fantastic.
And then, you said it'll get better and better up for
Yeah.
9 months. So
You're doing fantastic.
there's nothing I won't be able to do.
It's amazing. This guy was using a cane and walker when he saw me.
How long has it been since your treatment? For last time we saw you, you were about the 6-month mark. Where are you at now?
A year and a week.
Okay, great. And how are you feeling now?
Feeling great.
Good.
Couldn't ask to be better.
And have you noticed more improvements since when you were here at 6 months?
Yes, I have. A lot of improvement.
What's changed now?
I don't hurt. I don't limp. My hair started to grow back up here. I just feel great all over.
Wow, that's fantastic.
I feel like I'm 50 years old again.
Awesome, awesome. That's great. And I know when you first came in, you were using a cane and a walker. Now, how's your movement now?
Great. I feel like I'm 40 years old.
Okay. Well, we're going to show a little video of how well you move so people
Good,
can
good.
see how you're doing.
He's so cute. I love that he's so excited that he can like do all that stuff.
Yeah, he's amazing and he's still doing well. It's been probably 5-6 years now since we treated him. So it's just, nothing's been more satisfying or more fulfilling as a person and a physician as helping somebody who was using a cane and walker run down my hallway, so that's just how powerful these treatments are, and they're so safe and effective. It's just it's a wonderful thing, and I'm excited that Dr. Ann's already seeing some great results up in Boston, and I can't encourage people enough to please, don't wait. It's if you're hurting, if you're having health issues, if you have friends that are having health issues and they've been struggling, suffering, they have nothing to lose but everything to gain to go see Dr. Ann and Courtney and get some help.
You know what's so funny? Can I say something? You know what's so funny? Everybody always says to me, because I'm 69 years old, but I've been working out and taking care of myself. Like I said, I used to go to Nancy, and people, they always say, "Oh, you're gonna be all right. You're Blasian. You'll be fine because you've always taken care of yourself." And people always want to know, what am I doing? So I can't wait to tell them about this. I really can't wait, because I know that there's a lot of people out here that have issues like with knees. One of my friends said that she had to have surgery on both her knees. And I was just telling her, yes, today, before you do that, you should look into alternative medicine. And so she said, well, where would you go? And I didn't know where to go until I got this email this evening, So now I can take it back to her, and she'll tell somebody, and I'll tell somebody else, and everything. So I'm so excited about this stuff.
Awesome.
I'm really excited.
Myra,
We're all
see
excited for you.
see if she has time on Friday. Maybe she can come in with you, or maybe she can do a Zoom. Because if she's, thinking about that surgery route, maybe if she hears about what's possible, she won't have to.
Yeah, well, that's what I'm going to do. I'm going to see if she can, she'll probably do it on Zoom, because I'm not waiting on no one. I'm just coming from work.
Yeah.
I'm not going to pick no one up. I know what I'm doing. So, but if she hears it from you guys, I think that she, take a chance. I know she would. Okay. So I'm going to tell her
Awesome.
and give her the number.
So we have a couple more questions.
But I have to go. I do have to go.
Bye, Myra.
But
See you
thank
Friday.
you. And I'll see you on
Good luck.
Friday.
Good luck with
Yeah,
everything.
thanks. All right.
So another question, the joints that have been bone on bone, how will these procedures prevent the bones from eroding if there's no cartilage?
So great question. The cartilage can actually regenerate itself, as the one picture that we put up in the presentation I went through showed a knee before and a knee after. The knee before had terrible bone on bone arthritis where, it looked like the cartilage was completely gone. The meniscus is gone. But that person, after a year, that cartilage had regenerated and returned back. So even though it may look like there's nothing left, the body can heal itself. And worst case scenario, these treatments help cushion, they help with inflammation. So yeah, even if you don't see a big change on x-rays with differences in people, we've seen some people go from where they're in pain every single day to no pain, just from helping with inflammation and with cushioning the tissues. So it's just amazing, again, how these therapies work and what they're able to do.
We have another question. Would I need to have my MRIs and x-rays available for the initial consult? And in terms of those records, do you only need the reports, or do you want the actual images on DVD, etc.?
Reports can work well.
Go ahead, Ed.
Oh, we'll look at anything, but a report is really my preference. I don't read MRIs all day long anymore. There was a time in my career that I did. I trust the written reports, and you can have the consult without them. We've done some treatments. It helps us determine where and how we're going to inject the more information that we have. So more information is better. Reports are fine.
And
Exactly.
for your initial consult too, you can get on the phone or a Zoom or in office with Courtney and kind of go over all of this information, and then, kind of set that up, get the information that you need to feel comfortable, and then send in the reports before
This
your treatment.
Yeah.
Well, thank you guys all for being, one more.
Okay, good. Last question.
Can a consult be multifaceted, hip and shoulder, oh no, you can do your consult for all of the things that you have concerns with. So one appointment, either Zoom or in person, and bring all of your concerns.
There you go. Thanks for joining us. I'm delighted to have the support and experience of Dr. Ambrozic with us, and a terrific nurse practitioner and a wonderful marketing team now helping us get the word out so that people know that there are options for them. I look forward to the stories and the successes and the journeys. So please follow up and follow through, and please take advantage of this introductory type pricing that we're giving just to our clients. This is not something that we offer anyone else coming into the clinic. So take advantage of it if you're able, and we look forward to helping you.
And I'll send you all an email if you do want to book with Courtney via Zoom. And then you can either call to make an in-person appointment as well. And we'll send you information on the special pricing as well. Good night, everyone. Thank you so much, Dr. Ambrozic, for joining. And
My
sharing
my
awesome-
pleasure. My pleasure. You guys take care, everybody. Thank you for tuning in.
Bye.